Hello athletes and parents, my name is Renee Kuhn, and today we're going to be going over some possible injuries that your student athlete may be at risk for while they are playing softball. So if you're new at playing softball and you're not quite sure exactly what the sport entails of, softball was invented in Chicago in 1887. It is a bat and ball sport. It is also a field sport. Softball is mainly played by women, but men play as well. It is performed in two different ways. You will be able to see it in slow pitch and fast pitch. In high school and below, you will usually see it being played in fast pitch. Some possible factors for injury in softball are women are more prone to ACL injuries. The reason that this is women's ligaments have more laxity in them. Another reason is because they have slower reflex times, and our muscular strength is not as strong as males, so that is why females are more prone to ACL injuries other than men. Another possible factor for injury is weather conditions like rain. The reason that this is because that the field becomes more slippery, so we are more prone to slipping and not having really good contact with the ground. The three most common injuries among softball players are subacromial impingement syndrome. Subacromial impingement syndrome is when the tendons of the rotator cuff and the subacromial bursa are pinched in the narrow space beneath the acromion and become irritated and inflamed. The next most common injury among softball players is the anterior cruciate ligament tear. The anterior cruciate ligament is comprised of three twisted bands: the anteromedial, intermediate, and the posterolateral bands. Injury of the anterior cruciate ligament happens when overstretching of the ligament occurs. The last most common injury among softball players is the anterior talofibular ligament tear, also known as the ATFL tear. Anterior talofibular ligament is connected to the talus or connects the talus to the fibula. The tear of the ligament occurs when the ankle experiences an inversion twist. A little more about the subacromial impingement syndrome. The mechanisms of injury are excessive overhead use. So this means that you're going to be reaching above your head a lot of the time. The reason that softball players might be having excessive overhead use is because of throwing and catching the ball. The anatomy of the injury. The rotator cuff, the subscapularis, supraspinatus, infraspinatus, teres major, subacromial bursa, acromion, and the humerus are all affected within the subacromial impingement. The anatomy assessment, so ways that we will see if your child is experiencing subacromial syndrome. We can do an MRI. We can also identify their range of motion and electromyography. So some treatment for your child if they are identified with subacromial impingement syndrome. We can do conservative treatment. This means that they're going to be resting and stopping the offending activity, so no more overhead use. Another treatment is non-steroid anti-inflammatory drugs. This is used to treat pain and inflammation. We can do physical therapy. This means that we're going to have your child do certain exercises and stretches to bring back their strength. And for rehabilitative and preventative exercises, we can do a shoulder raise, posterior shoulder stretch, and interior shoulder stretch. And those are just some exercises that you can do for preventative subacromial syndrome. There is also a lot more other than those that you can perform. So a little more about the anterior cruciate ligament tear, which I have experienced. The mechanisms of injury is changing direction. Softball players oftentimes are changing direction instantly. This could be if they're caught in a pickle or just after taking off from hitting, or just going from first base to second base or second to third. Also when you're out in the field, when you go to catch the ball, you just do instant movements. So this can affect your anterior cruciate ligament. Another ones are hard impact. This could be from sliding, landing from a jump, also internal knee rotation and landing from a jump, and overextending your knee. The anatomy of the injury is with your anterior cruciate ligament. The anatomy of assessment, so how we would determine if your child is experiencing an anterior cruciate ligament tear, is the Lachman test. This test can be done out in the field. There's no need to go to a hospital or doctor to be able to perform this test. But the other test that we can run is a magnetic resonance imaging. This is an MRI, and this does have to be done in a doctor's office. So some treatment options if your child experiences an anterior cruciate ligament tear, or some physical therapy. During physical therapy, this is going to help strengthen the anterior cruciate ligament. It's going to help them regain movement and reduce the pain and swelling. Other than physical therapy, if they need surgery, some surgery options are reconstruct or repair the anterior cruciate ligament. So during reconstruction, a graft is used to replace the ligament. This means that they are not going to be using their ligament. And if they are going to just do repair, they will be using the same ligament that they have. Rehabilitative and preventative exercises that your child can perform are heel slides, wall squat, and bridge exercises. Again, this is just a few exercises that they can perform. It's not all of them. There are many more out there that they can perform. And a little more about the anterior talofibular ligament tear is if you are actually experiencing an anterior talofibular ligament tear, you're most likely also going to be experiencing an calcaneofibular tear. They kind of just go hand in hand with each other. But the anterior talofibular ligament tear, the mechanisms of injury for one, is incorrect landing, hard impact, rolling the ankle inward, plantar flexion, and inversion of the ankle. The anatomy of injury is the anterior talofibular ligament. It also includes the talus and the fibula. The anatomy of assessment, so ways that we will be able to see if your child is experiencing an anterior talofibular ligament tear, is there will be swelling around the ankle and around the foot. There's going to be discoloration. This also will just be around the ankle and the foot. Anterior drawer test, the Teller tilt test, and the radiographics. The anterior drawer test and the Teller tilt test can all be done out in the field, and radiographics would have to be done at a doctor. So some treatment options for the anterior talofibular ligament tear is RICE. This means rest, ice, compression, and elevate the ankle. This is one of the most important treatment options that I believe is out there for the anterior talofibular ligament tear. It's going to relieve pain, swelling, and it allows for your ankle to be able to heal and regain that flexibility and strength back. Another one is functional rehabilitation. This means so after all the swelling and everything has gone down, you would then perform a functional rehabilitation. This is where you're going to exercise and perform stretches, and this is also going to help regain the strength and movement. Rehabilitative and preventative exercises that you can perform are toe raises, chair squat, and single leg squat. And again, these are only a few of the options of exercises that you can perform. There are a lot of other exercises out there. Here is an example of the rehabilitative and preventative exercises for all three injuries. So now you may be asking yourself, why would I allow my child to play softball after they're at risk for all of those injuries? Well, I want to reassure you that it is our number one focus to make sure that your child is performing exercises and stretches to prevent those injuries from happening. And your child is going to be a part of a team. They get to gain exercises, learn new skills, improve skills that they already have. Your child is going to stay healthy. They're going to make friends into family. And it's going to boost their self-esteem, relieve pressure and stress, and most importantly, they're going to have fun.